My name is Anna Bradford, and I'm a student in the Department of Health Policy and Management working on a PhD. The morning of 9/11, I heard about it on the radio and had been scheduled to arrive at work around 10 o'clock in the morning. And I'm a social worker, I'm a trauma social worker at INOVA Fairfax Hospital. As I was driving to the hospital is when the Pentagon was hit. And soon after I arrived at the hospital, it was very clear that we were going into disaster mode. When I arrived, I checked in with the team leader who put me into a particular role in the hospital, accepting phone calls from the community members who were looking for their family members. It turned out Fairfax Hospital got 0 patients on that day. The emergency rooms were all turned into ORs, and the hospital was completely ready to take on this disaster. But what happened was the only part of the hospital that in fact was doing anything was the call center. And we received on that day 700 phone calls from family members who were desperately searching to find their loved ones. Knowing that the patients weren't coming to our hospital gave us a rather desperate feeling. And I think in many ways, being a part of the healing process for families, even though all it was talking to them on the phone, was the best thing that we could do. And in fact, I think the ER workers didn't have, in many ways, the benefit that we did, which was to actually be connected to the community members. Even though we knew we weren't going to get any patients, in some way, once you leave the hospital, it then became a personal story rather than a professional story. And being a crisis worker, it's a lot easier to work on the side of being the worker than it is to be on the side of being a citizen who is now having to accept and understand what is happening to the country.